Okay, everyone, thank you again for coming. We're going to get started now. I'd like to introduce my colleague, Robin Roland Levy. She will be kicking off our teleconference.
Thank you. Welcome to the IMF Copay Assistance Programs and Concerns webinar. As you can see, next slide, please. Tonight's speakers will be myself. I'm the Senior Director of Public Policy and Advocacy for the IMF, and Paul Hewitt, who's our InfoLine coordinator. And most importantly, all of you on the phone, patient and caregiver stories. We are really interested in hearing your experiences with this particular situation. Next slide, please. So just to give you an overview of the agenda tonight, we're going to discuss some of the issues. Then we will hear from our patient and caregiver stories of those of you on the phone. And then we'll talk about next steps and things that you can do and actions that you can take. Next slide, please. So as you all are well aware, over the past few weeks, the IMF InfoLine has been flooded with calls from patients and caregivers facing insurmountable financial challenges due to the high cost of drugs and increases in insurance copays. In the past, several services have been available to provide financial assistance to patients, but in the current atmosphere has severely limited the availability of those funds. Next slide, please. So insurance coverage has not kept pace with the innovation in medicine and the growing trend towards orally and other patient-administered chemotherapies. Traditionally, intravenous IV and injected treatments were the primary methods of chemotherapy delivery, which are covered under your health plan's medical benefit, where the patient is only required to pay a small office visit copay. Today, patient-administered chemotherapy has become more prevalent and the standard of care in many types of cancer. Oral chemotherapy also accounts for approximately 35% of the oncology development pipeline. And more importantly, many oral anti-cancer medications do not have IV or injected alternatives and the only option for some cancer patients. As these medications become more prevalent in cancer treatment, they must be affordable. They must be as affordable as their IV counterparts. And since patient-administered anti-cancer treatments are often covered under health plans' prescription benefit, many patients are responsible for extremely high and unmanageable copays. These copays can be hundreds or thousands of dollars per month, and as a result, a lot of patients choose not to fill their initial prescriptions for these medications. This is the way that we're treating cancer is changing, and oral anti-cancer medications are playing an increasingly important role. So as you all know, and I don't have to tell you, they are available in pill form and they are directly attack cancer cells and often with very few side effects. This disparity, the oral anti-cancer medications are usually part of our healthcare plan benefit and in high burdensome out-of-pocket costs through coinsurance require patients to pay a percentage of the overall cost of the prescription drug. This disparity negatively impacts patients' adherence and forces physicians to make decisions based on outdated health plan benefit designs rather than what is best for the patient. So how can we fix this and what can we do? While we don't claim to have all of the answers tonight, we do have some of the things that we've been trying to do. I'm sure many of you are aware of the Cancer Drug Parity Act. The Cancer Drug Parity Act is a federal legislation that requires any health plan that provides coverage for cancer chemotherapy treatment to provide coverage for self-administered anti-cancer medication at a cost no less favorable than the cost of IV, court-administered, or injected anti-cancer medication. The law is not a mandate, as it only applies to health plans that already cover chemotherapy, and the bill ensures equality of access and insurance coverage for all anti-cancer regimens. Health insurance cost-sharing schemes should not create barriers to cancer patients' ability to access potentially life-saving medicine. Currently, the IMF and the Patient Equal Access Coalition and the State Patient Equal Access Coalition has worked hard to make sure that there is state legislation and federal legislation. Currently, 43 states and the District of Columbia of state cancer drug parity legislation. And the federal legislation, which was introduced this week by Congressman Leonard Lance of New Jersey and Congressman Brian Higgins of New York, is the way that we could ensure all those covered under federally legislated plans could get the same coverage as those under the state. So those are some of the things that we're trying to do, and something that we can currently do to work to alleviate this problem, is to federally legislate it to ensure that everybody and that all anti-cancer treatments are covered similarly. So now I'd like to hand it over to my colleague, Paul Hewitt, to discuss some of the teleconference ground rules.
Thank you, Robin. Again, welcome to the teleconference. We are here to hear from you. Just a couple of ground rules real quickly. Please limit your story to a few minutes. Please also respect that this is not a forum for political discussion. This is also not a place to seek medical advice. We ask that you speak slowly and clearly, and note that this teleconference is being recorded. By participating, you are granting permission to the IMF to use your stories to raise awareness of this issue. So, we've got some calls in the queue. You'll see a button where you can raise your hand to join that queue. And first off, we are going to go to, all right, I guess first we're gonna go for some polling questions. Okay. How many people are participating on this call from your location? A patient and a caregiver, perhaps it's a support group meeting. Which of the following statements most accurately describes your situation? 1, I or my partner has multiple myeloma. 2, I or my partner has another form of cancer. 3, a member of my family or friend has multiple myeloma. 4, a member of my family or friend has another type of cancer. 5, I am a concerned industry professional, i.e. doctor, nurse, pharmaceutical representative, insurance representative, patient advocate group representative. Please select the age range of the cancer patient on whose behalf you are calling. Under 45, 45 to 64, or 65 plus. More than one if I'm calling on behalf of several patients. And the last question, which of the following most accurately describes the cancer patient's health insurance coverage? 1, private insurance. 2, Medicare. 3, Medicare veterans benefits. 4, uninsured. 5, not applicable. Okay, so we're going to move on to our questions. The first comes from Robert Bruce.
I'm here.
Okay, we're ready for you.
Okay, there would not be this teleconference if it wasn't for the fact that the prices of these drugs are so ridiculously high. I am just above the income level where I have to pay full price. And I'm not complaining, and I certainly wouldn't be complaining if the prices were reasonable.
All right, thank you, sir. Our next question comes from Kate Farrell. Okay, Kate, sorry about that. Are you there?
I think I'm muted.
No, not anymore.
Oh, good. Okay. So I'm just for clarification. When we talk about the oral parity legislation at state level and at the federal level, do I understand that none of those bills apply to Medicare? They're all to private insurance. That I guess if you could explain, I'm not understanding why we hear so often that the government, aka Medicare, isn't able to negotiate with pharmaceutical companies. So isn't that a consideration here?
We will take your question. Our advocacy team will take your question and grab your email and have a discussion offline about that. We're just, at this point, trying to hear from patients how these financial situations over the last few weeks have affected them in their lives.
Okay. Thank you.
Thank you. So our next question is going to come from Mary Krasinski.
So my question is, I represent the cancer community clinics all across America, and we use the foundations every single day to help get drug to patient, and suddenly those funds have dried up and we cannot get the drug to patient. How can we remedy this?
That is an excellent question, and that is exactly why we're here today, to hear how these financial situations are affecting patient advocate foundations and patients alike. So thank you for that. All right. I guess Norman has dropped off. We're going to move on to Richard Carbone.
Hello?
Yes. Yes.
Hi.
Richard.
Yes, this is Rich. I had been using the patient access network for about 1.5 years now. Things have been going well. They've been covering almost all of my deductibles and things. I got a letter from them a few weeks ago saying that they were no longer funded for myeloma, and they were going to have to cut my funding. Luckily, the pharmacist I've been working with suggested I try the Leukemia and Lymphoma Society, and they had actually done that for me. They went through and put the application in, and thankfully I was accepted. So I'm now covered under a different program. But of course, with all this going on now, the worry is that program going to go belly up also?
Okay, thank you for that, Richard. We are now going to hear from Mary Polanich.
Hi, this is Mary. I submitted my question in writing. Why are you asking for questions if what you want to hear is stories? I'm afraid you're confusing those of us who are listening. Can you restate what it is you want? Thanks.
I apologize, Mary. That's my mistake. We are asking for stories, not questions. Thank you. Do you want to weigh in, Mary, with the story?
No, I'm currently in a 4-year remission, and I'm listening on behalf of my support group.
That's awesome. Thank you. We are moving on to Joyce Schultz.
Yes, hi, this is Joyce. Can you hear me?
Yes, we can. Thank you.
Okay. A couple of questions. One, as a support group leader here in Minnesota, would like to know what I can tell my other support group members about this. Received some calls on it already this past week. Also, I get assistance with my insurance premiums through the Leukemia Lymphoma Society. I sign up for my health insurance, which is a very good plan, through my previous employer. It runs from January to December every year. I renew my LLS grant in July of every year. So I'm very, very concerned that by the time I get to July to renew my grant, the money will not be there, and I won't be in a position to even sign up for a Medicare and supplement type of combo at all, because I'm obligated from January through December with my current insurance policy. So I could be on the hook, so to speak, for about $7,000. So it can work both ways, issues with insurance premiums and also issues with the copays of prescriptions. And I just would like people to be aware of both and to fight for solutions to both.
Thank you very much for that. Okay, we're moving on to Nancy Boyle.
Hi there, this is Nancy. Can you hear me?
Yes, we can.
Hi, Nancy Boyle. I'm a social worker at Oregon Health and Sciences University Hospital and the Knight Cancer Institute. I guess I was a little confused because the webinar was called Address Concerns, and I guess what I'd like to help maybe clarify, it sounds like what IMF would like to do is collect information regarding what the situation is nationally and how people are doing. Is that what I'm understanding?
Yes, exactly.
Okay, so because that was confusing to me because I thought that it was a webinar to, say, here's where other people are going, needy meds, they're going to LLS, they're going to other places. So I guess that maybe is why we're kind of getting a slow start here.
Right. What has happened is all of those patient foundations that would generally have funds set up for people to get assistance from have all dried up. And
so so I think that would have been helpful maybe to start with, to say, a little bit more about the state of affairs, because I think a lot of people are looking for answers and, even saying it doesn't sound like we have any answers, but if we can collect numbers of people and where they are and what are you having to pay out of pocket and how is this affecting your standard of care. I think there was an allusion to that in the beginning with your first speaker saying, they're having to rely on second-line therapies. And what can we do to advocate, with the companies, with the funders, with people? I think we look to organizations like IMF to help us, gather that and put that together. And maybe that's just me, but I'd love to hear if that's what other people are looking for.
Yes, that's exactly what we're looking for. We want to hear from patients how this is affecting them and their families and their lifestyles, because at this point there aren't any answers, and we'd like to be a clearinghouse of these stories so that we can share them and hopefully get some changes made. In the last 2 days, we understand that the Leukemia Lymphoma Society and Cancer Care have been refunded. So they do have some funds set up, so we would encourage you all to call them and see what assistance you can get.
Great.
Know that those funds will dry up quickly, so time is of the essence. Okay, so we're going to move on now to Glenn Hale.
I should be available now. I was a little curious about what the webinar was about, because I had questions too, and having the and I guess you don't have the information as far as the Parity Act, whether or not it's federally done, or not it's just on the state level right now. Medicare's part of it or not. That's information that most listeners would actually like to know and to hear. And the previous callers have on the previous two have kind of put us back on kind of the track that we're actually would actually like the webinar to have, and that's like answers to two questions we have. And stories are actually fine too, but it's also good to have answers to the particular questions as well.
Thank you for that. And we would encourage you to call our info line at 800-452-2873, Monday through Friday from 9 a.m. to 4 p.m. Pacific time. We are here to help and answer questions for you. this format was set up so that we could hear from the patients, because at this point, we don't have any answers. Your stories are going to help us go to the places where we can share your stories to perhaps affect some change.
Okay.
So that's why this was set up this way.
Okay.
And if you want to go to our website and click on the advocacy portion of it, there's a great descriptions there of the Oral Parity Act. You can learn all about it there. You can email the advocacy team and begin dialogue with them as well.
Okay, great, because I was diagnosed about 5.5 years ago, and my insurance company at the time, I explained to them what was going on as far as intravenous drugs and the oral, and that I needed parity, and there was a parity clause in like the state that I'm actually in, and I was told that they don't have to abide by it because it's not federally, it's not a federal, it's a state law, and they are regulated federally, and so the insurance companies don't have to abide by the state parity laws. And so that's the need for a federal law as well. It's because of that.
Well, thank you for that. I'm sure the advocacy team is noting your comments, and we did get a message that people would like it repeated which funds have been refunded. Those are the Leukemia Lymphoma Society and Cancer Care. We will have a slide at the end of this presentation that has their information on it for you.
Okay. LLS, I've been getting a grant through them, and that's been really helping me out. But I'm real concerned because of the lack of funding now. That when my renewal's up at the end of the year, that there's not going to be any funding, so I'm really concerned about that. And Chronic Disease Fund, I was getting some assistance there too as well, and this past year is when they told me that they don't have funding at all. So I was concerned about that as well.
Right. All right, well, thank you for weighing in, Thomas, with your story. I'm sorry. That was Glenn. I apologize.
Yes,
we're now
okay,
moving on. Yeah, we're now moving on to Thomas Good. Thomas, are you there?
Hi, this is Thomas. Can you hear me?
Yes, we can.
So I have a question for all of the listeners out there. You know, everybody is talking about how, you know, they use the Leukemia Lymphoma Society for support. How many of you actually help the Leukemia Lymphoma Society raise money for us that's going through this stuff like this? Generally speaking, there are a lot of people that like to use the funds for leukemia lymphoma, but they don't step out and help during Light the Night and the Man and Woman of the Year Foundation to help raise the money that we use for these situations. You know, it's not just for cancer research, but the copay assistance fund, that comes from the same amount of money that we raise during these programs. So I would like for people that utilize the money to reach out and help earn the money that's going back out to the patients. That's all I had.
Thank you, Thomas, for that. We appreciate it. The next story is coming to us from Carola Draxler. Hi, Carola, are you there?
I'm here.
Hi there.
Hi. It said I'm muted.
You're not.
No, we hear you.
Okay. Well, this is new, so I'm not yet impacted, but I wanted to say that I got support from PAN for my induction chemo, And had I not had that support, I would not have been able to afford the therapy that my specialist and that is standard of care for myeloma patients. This is critical. People won't get the therapy that they need. And so that's my comment.
Thank you very much for that. We're glad you got help. We're moving on now to Brian Metcalf. Brian, are you there?
Hi.
Hey, Brian.
Hey. Speaking of Pan, I'm calling for my mother. My 77-year-old mother has myeloma, and just a few days ago, she got a letter from Pan Foundation notifying her that the program is ending due to unexpectedly high volume of claims. She's in the middle of perhaps a best guess 1 year sort of remission right now. Ended treatment in about September, and hopefully we'll have at least a year, until September before treatment might need to resume. But we're concerned, of course, because now finding out that the funding has ended, so we're at a loss right at the moment as to how we're going to continue. So that's my story. And I want to thank you for hosting this webinar, and I hope some good stuff will come out of this. So thank you.
Thank you, Brian, and of course we wish you and your mom well. We're moving on now to Camille Anter.
Hi, this is Camille. You can all hear me? Okay.
Yes, we can. Thank you.
Okay. Well, I want to give you a little bit of a background on my husband's story. He has been treated for myeloma for 6 years. 5 of those years he had private insurance, which only left us with a $2,500 deductible, which was manageable. This year, however, he did move to Medicare. And we were shocked to find out with Medicare coverage, Part D prescription coverage, he is on Revlimid and Ninlaro, that coverage would cover him only for the first 2 months. Then we would fall into the donut hole, and our advisor said he was sorry to tell us that we would be on the hook for $14,000 that we would have to pay out of pocket before we would get out of the donut hole and Part D would resume coverage for us. We did apply to the Leukemia and Lymphoma Society, and we were able to get a grant for $10,000, which was a huge help, but that still leaves us on the hook for $4,000. So switching to Medicare this year was a huge, huge surprise, not realizing that we would be on the hook, like I said, for $14,000. So when we go to reapply in July, we can only hope and pray that there will be funds available at that time. But I'm interested in hearing if there are other people out there that are on Medicare. Are you finding the same issues moving from private insurance to Medicare?
Thank you for that, Camille. At this time, we're moving down to Jenny Lawrence.
Hi, so I am a relatively new myeloma patient, and I am on private insurance. I live in a state that does not have the parity law, and for example, for me personally, my copays for the medications that I do take orally went up 75% starting in January. We found out about this around December. And I tried to apply for some help, but the organizations that I went to, either I didn't qualify or they had no funds available. So since January, these copays have been astronomical. Again, I'm very thankful I do have a type of insurance, but it's becoming practically, impossible to pay these copays. I did undergo a transplant in the last few months as well, so when you add that on top of this, it is really difficult. Thank you.
Thank you for weighing in, Jenny. Our next story comes to us from Martha Raditz.
We're both here. Can you hear us? Now, this is Bill Raditz and my wife Martha. Martha's been in treatment for myeloma since last May.
Hey, excuse me, sir. Are you on speakerphone? It sounds very echoey. I'm not sure if you can.
No, just my iPad.
Okay. Okay, go ahead.
Okay, my wife Martha's been on treatment for myeloma since May. It was such a act of grace to learn that there was help at that time, and essentially that our copay would be covered. And it's been covered now for many months, even though we had to change medicine at one point. And then we got this letter actually saying that starting a month ago, so it's even back a ways, we would have to assume the copays. So that we're guessing at this point that tomorrow when we pick up the medicine, we're going to be having to pay the $2,500 to $3,000.
No, we're not guessing. They told us tomorrow when I pick up my medication, which will take care of me for the next 3 weeks, I will be paying $3,000, $1,000 a pill. So I will have to whip out my credit card tomorrow and pay $3,000 to continue my treatment for another month.
And we're 71 each of us and retired, and I've got a retirement plan. So if we're having to look forward to this now for many months, I guess I'm surprised it just came so suddenly that without being able to plan for something like this, and it's really going to impact the way we budget.
Not that you can plan for paying out $3,000 a month for medications.
And by the way, just to respond to Thomas, who was on earlier, yes, we've been part of Light the Night here in San Diego. So.
All right. Well, thank you for that, Mr. and Mrs. Raditz. We're now moving on to Megan Hammond.
Can you hear me?
Yes, we can. Thank you.
All right. I am actually a caregiver. I'm a nurse coordinator for a multiple myeloma clinic. When all of this closing funding, it went from 7 to 1 very quickly. I started calling random, all the pharmacies I could, I called Celgene, I called Takeda, anybody that I could think of that it would be affecting. One specific pharmacy, I recall I talked to my liaison there. She said it had affected 1,000 patients in their specialty pharmacy alone. That number is astronomical, so we were very quickly trying to determine who to put on Leukemia Lymphoma Society as quickly as we could. My concern is not only for my current patients that fall into this, but also our clinic sees a lot of new myeloma patients as well, a lot of whom are on Medicare and can't receive copay cards from the medication companies because they won't give copay cards to Medicare patients for, I think, legal reasons. But the issue becomes, I love Leukemia Lymphoma Society, but it's 2 to 4 weeks of processing time for them to process new applications. And I have a couple patients who are going to be going on Medicare soon because they have to. And then with our new patients, if we're starting induction, we'll be starting, Revlimid or POM fairly quickly, especially they come to us in a state of an emergency. And we have a couple patients even today that have come to us with very high counts. And I just think of them, and if they're on Medicare, I don't know what to do other than, my provider and I talked about, if we can't get the funding quick enough, it might have to be that patients will start with something IV or Velcade or something similar to be able to afford their medications, because the 2 to 4 weeks waiting on Leukemia Lymphoma Society applications, these patients can't wait 2 to 4 weeks, but they also can't afford thousands of dollars in copays. So it's quite tragic. It's terrible. But I also have a patient who decided, and luckily they're in an okay spot with their myeloma right now, but they're foregoing their chemo this month because, you know, waiting on all of the foundations, wondering if they're going to also not have funding. I mean, she has $450 of copays for 1 month pills, and that's a huge amount of money. And she,
Megan, we're starting to lose you. I think perhaps it's some cell interference. Unfortunately, I think we've pretty much lost Megan, so we're going to move on to Steve Weinstein.
Can you hear me?
Yes. Hi there.
Hi. I'm a support group leader in Florida, and a couple of things, and this doesn't help tremendously and can be difficult, but we have had some folks start a GoFundMe page. We've also had some folks find clinical trials to hopefully qualify for to ease the financial burden of the drugs. One of the things I would like to point out, with each of the different organizations that provide funding, they have different programs. Some are for travel, some for copay assistance, and some for insurance premium assistance. And each one of those programs is funded differently. So while they may be out of money for one program, if you have a need for the other, you might look into that. And I do know that you and Judy have quite a list of organizations that you help people with. And Thomas's comment earlier was quite well taken about fundraising. You know, we're trying to raise money for myeloma research, but in the meantime, we need to raise money at the same time for myeloma treatment. That's all I have.
Well, thank you for that, Steve. It's good advice and I'm sure helpful for people. Next story comes from Suzanne Krebs.
Thank you for taking my call.
Of course.
Our situation is my husband has private insurance through his employer, and we will be in real trouble, of course, if these funds dry up, because we have a $6,800 out-of-pocket maximum each year, but his employer, the way their insurance works is that they start over in October. So even though it's supposed to be $6,800 a year, their plan starts again in October, which adds on however many more thousands of dollars. It will be from October through December, which seems really unfair, but that's, I guess the employers are allowed to do that if they so choose, and it's a small business, so that's how they work it. So without the assistance, which we were able to get last year through the LLS, it will be, you know, on the hook for maybe $10,000, which is a huge blow to our income, of course. And so I just wanted to make people aware of that there are holes in, you know, gaps in the insurance that you have, whether, I guess Medicare can be problematic, but also through the private insurance as well. So thank you for hearing that, and for what you're doing to get the awareness out that without the help that, you know, a lot of people will be in financial difficulty. Thank
right.
you.
Yeah. Thank you, Suzanne. I'm sorry. Thank you, Suzanne. Yes, we're going back to Megan, who was cut off just a few minutes ago.
so did any of the last comments go through at all? You said it was cutting out.
Yeah. We heard a lot of what you said. I can't.
Yeah.
Yeah.
So it's mainly just the sheer volume of the amount of patients. When I found out it was 1,000 patients in one pharmacy alone affected by this. And then we've been calling all of the pharmaceutical reps, and then as well as our pharmacies, trying to get some guidance. Unfortunately, care patients are getting hit the hardest because luckily for our commercial patients, they've been able to, you know, look into copay cards, that kind of thing. But we have one patient who just decided to forego her treatment entirely this month while waiting, because the turnaround time to be accepted in the foundation was 2 to 4 weeks, and she had a $450 copay for 3 pills, and the month, which is, you know, when you add that up for the year, that's a lot of money. And so she decided to forego her therapy this month. Markers are under control, but that's kind of what some of our patients have resorted to. And then my biggest fear is for our, not only my current patients, but the patients that are coming in. We get about 4 to 6 new patients in a day sometimes. And, you know, the golden standard of therapy, you have a lot of Revlimid. And if somebody's on, you know, needing that induction therapy with Revlimid or pomalidomide, and they're on Medicare, where our option is a 2 to 4 week turnaround with one of the only foundations we have left while they're still here. And I'm so happy they're still open. But the fact is these patients on, especially on induction or relapse, they cannot wait 2 to 4 weeks. And so trying to figure out funding for them has been challenging and heartbreaking. And that's where I'm really hoping we find a solution soon, because it's just my heart's breaking for all of these patients that need that support. I did try and reach out to the pharmaceuticals, and as of late, I have not received any talk of price cuts or anything like that. Because I was hoping that maybe that they heard some of this that was going on, that they would maybe feel the need to step in and decrease costs. And that was kind of upsetting too, to hear that I didn't hear anything about decreasing costs on their end either. I was so happy to hear about cancer care opening up today. That was very good news. I hope that we see more foundations reopening like that. But it's definitely a worry.
Just to reiterate that, the Leukemia Lymphoma Society, the LLS, and Cancer Care have funds as of yesterday and today. So everybody get on that. We'd like to thank everyone for participating today. These are very powerful stories, not certainly as powerful as the realities are that affect you and your loved ones. So we're going to show our last 2 slides here. The first is to remind you to call the support lines of the pharmaceutical companies for the drugs you've been prescribed to see if you do qualify for their assistance programs. They all have assistance programs, and they're listed here. And we will email all of the attendees of this call these slides, so you can have these for your records. They go from Celgene, Takeda, Janssen, Amgen, Novartis, Bristol-Myers Squibb. Additionally, there are patient assistance foundations, 2 of which we've mentioned today, the LLS and Cancer Care. You'll also see that the Patient Advocate Foundation is there, Good Days, formerly Chronic Disease Fund, HealthWell Foundation, and the Patient Access Network. Again, we will be emailing this slide deck to all of you so you can have all of these resources for your records. We encourage you to reach out to get help from all of these resources and to call us at the info line at the IMF. Again, that's 800-452-2873. You can also reach out to our advocacy team from our website, the advocacy portal there. And if you're not involved in a support group and there's one nearby, please do join. It's a great, powerful place for you, a great resource of camaraderie and also of knowledge. They have great speakers come to speak to their groups, nurses, doctors, pharmaceutical companies, and it is just a great empowerment tool for you. So that concludes our call today. We'd like to thank you again for sharing your stories with us, and we look forward to hearing from you via our phones or our web. Thanks again.